Panic attacks. When to seek help. Imagine this scenario. You're about to go to a job interview, or maybe you were asked to do a live presentation at work, and you are suddenly gripped by an inexplicable fear, feeling your heart pounding, and the next minute you have buckets of sweat rolling down your face. And to top it all, you are now trying to catch your breath. If you experience this regularly, you might be having panic attacks. Hello, I am Dr. Hanzy Bustamante, and I want to welcome you to my YouTube channel, Dr. Hanz MD, where we 10x your success by optimizing your health. What does Johnny Depp, Kim Kardashian, Ryan Reynolds, Oprah Winfrey have in common? Well, aside from their fame and lavish lifestyle, they also suffer what some of us experience from time to time, and that is those dreaded panic attacks. In this video, we will be talking about panic attacks, and we will answer these top 3 intriguing questions. Number 1. Are panic attacks normal? Number 2. What are the signs to look for to seek for professional help? Number 3. What can you do to minimize your panic attacks? Meet Amanda. She is not a celebrity like the ones we have mentioned earlier, but she is a vibrant young adult with a passion for her profession. However, Amanda is also living with panic disorder. Unexpected frequent episodes of fear creep up on her, often mistaken for serious medical emergencies on several occasions. Besides the terror each attack brings, the constant worry about the next one haunts her. Her work suffers, as does her social life. Amanda finds herself avoiding places and situations where escape is difficult. This causes her to gradually withdraw from life's joys and pleasures. So what does she need to do to get her life back? For us to help Amanda, we should first talk about what panic attack is. A panic attack causes a sudden, temporary feeling of fear with strong physical reaction in response to ordinary, threatening situations. When you have a panic attack, you may sweat a lot, you may have difficulty breathing, and feel like your heart is racing. It may feel like you're having an actual heart attack. A panic attack is a collection of symptoms in response to stress, whether real or imagined. And to answer the first question, a panic attack can be normal, and up to 35% of the population can experience it in their lifetime. But once you notice several episodes of panic attacks, you need to look into what's actually causing them. First, it is very important to see your primary care doctor, so together you can rule out serious medical conditions. These may include an overactive thyroid gland, heart disease, and various lung diseases. Certain medications like inhalers for asthma, cough, cold medications, steroids, and caffeine-containing products can also induce panic attacks. It is vital to review these medications with your physician before starting or stopping them. Alcohol, smoking, and recreational drug use can also trigger this condition. Once a medical and substance-related cause of panic attack have been excluded, it is vital to talk to a mental health professional to determine if you have panic disorder. So to answer our second question as to when to seek professional help, if you or a loved one experience recurrent or unexpected panic attacks, along with 1 month of either worry about future attacks or the consequences of attacks, and significant change in the behavior is noticed due to the attacks, like phobic avoidance or repetitive seeking of medical evaluation, it is time to seek professional help. And once a diagnosis of panic disorder is made, our next step is to determine, based on clinical assessment of severity of illness, extent of distress or impairment, and patient preference, whether the treatment of this disorder is needed. The main objectives of the treatment are to minimize attack frequency, anticipatory anxiety, phobic avoidance, and thereby improving the patient's functioning. And for the final question, here are some suggestions from the Cleveland Clinic on how to minimize panic attacks. Number 1, identify triggers that bring on panic attacks. Learn strategies to manage your triggering events to prevent an actual attack. 2. Avoid caffeine, alcohol, and smoking, as this can make panic attacks worse. 3. Exercise regularly to help you manage stress, relieve tension, and boost your mood. Eat a healthy diet and manage stress in healthy ways. Number 4, talk to your doctor before taking any herbal supplements or over-the-counter medications. Certain substances do increase the likelihood of an anxiety attack. Now back to our story. Amanda decides to fight back. She seeks help from various medical professionals and she embarks on a journey through medication and cognitive behavioral therapy. Despite hesitation and side effects, Amanda's determination propels her. Slowly with time and a lot of hard work, her life starts to improve. From being a victim of her fears, she became the victor, regaining control of her life. Through our journey with Amanda, we hope that you understand the struggle, resilience in the lives of those with panic disorder. Regardless of the path that they choose, the goal is the same: to regain control of their lives fully once more. This has been Dr. Hanzy Bustamante. If you found this video useful, give it a thumbs up, share it, and don't forget to subscribe to my YouTube channel, Dr. Hanz MD, where we talk about your health plain and simple.